Obstructive sleep apnea, or OSA, is a prevalent sleep disorder affecting millions worldwide. It's characterized by repeated interruptions in breathing during sleep, often caused by the collapse of the airway. These pauses in breathing, known as apneas, can last for several seconds or even minutes, disrupting sleep and leading to a range of health problems. Understanding OSA is crucial for early diagnosis and effective management. This pervasive sleep disorder can significantly impact an individual's quality of life and overall health. OSA is more than just occasional snoring, it's a serious medical condition. The repeated cessation of breathing during sleep deprives the body of oxygen, putting strain on the cardiovascular system. This can lead to serious health complications over time. Recognizing the symptoms and seeking timely treatment is vital for mitigating these risks. OSA is a treatable condition, and early intervention can significantly improve outcomes. The impact of OSA extends beyond mere daytime sleepiness. It can increase the risk of developing high blood pressure, heart disease, stroke, and type 2 diabetes. Untreated OSA can also contribute to depression, memory problems, and decreased cognitive function. The cumulative effects of sleep deprivation and oxygen desaturation can take a toll on both physical and mental health. It's essential to address OSA comprehensively to prevent these long-term consequences. Understanding the underlying causes of OSA is crucial for effective management. While certain anatomical factors like a narrow airway can predispose individuals to OSA, lifestyle factors like obesity and smoking also play a significant role. Identifying and addressing these modifiable risk factors can significantly reduce the severity of OSA and improve overall health outcomes. A comprehensive approach to OSA management involves both medical interventions and lifestyle changes. Loud snoring is often the most noticeable symptom of OSA, frequently disturbing bed partners or family members. The snoring is typically characterized by a loud, raspy sound, sometimes punctuated by periods of silence followed by gasping or choking. While snoring itself is not always indicative of OSA, persistent loud snoring accompanied by other symptoms warrants further investigation. It's important to distinguish between benign snoring and snoring associated with OSA. Excessive daytime sleepiness is another hallmark of OSA. Individuals with OSA often experience overwhelming fatigue and drowsiness during the day, even after seemingly adequate sleep. This can impact daily activities, including work productivity, driving safety, and social interactions. Daytime sleepiness can be a debilitating symptom, affecting an individual's ability to function normally. Morning headaches are a common complaint among individuals with OSA. The repeated drops in oxygen levels during the night can lead to vasodilation, causing headaches upon waking. These headaches are often described as dull and throbbing, and they typically improve throughout the morning. The presence of morning headaches in conjunction with other OSA symptoms should prompt medical evaluation. Other symptoms of OSA include waking up with a dry mouth or sore throat, experiencing frequent nighttime awakenings to urinate, known as nocturia, and having difficulty concentrating. Restless sleep, mood changes, and decreased libido can also be associated with OSA. Recognizing the constellation of symptoms is crucial for accurate diagnosis and timely intervention. The primary cause of OSA is the relaxation of the muscles in the throat and tongue during sleep. As these muscles relax, they can partially or completely obstruct the airway, making it difficult for air to flow freely into the lungs. This leads to the characteristic pauses in breathing and drops in oxygen levels that define OSA. The degree of obstruction can vary from mild to severe. Obesity is a significant risk factor for OSA. Excess weight, particularly around the neck and abdomen, can put pressure on the airway, making it more susceptible to collapse during sleep. Weight loss is often a key component of OSA management, as it can significantly improve airflow and reduce the severity of symptoms. Maintaining a healthy weight is crucial for preventing and managing OSA. Aging is another factor that contributes to the development of OSA. As we age, the muscles in the throat and tongue naturally lose tone and elasticity, making them more prone to relaxation and obstruction during sleep. This is why OSA is more common in older adults. While aging is an inevitable process, lifestyle modifications can help mitigate the risk of developing OSA. Other risk factors for OSA include having a family history of the condition, a narrow airway, certain medical conditions like hypothyroidism and acromegaly, and the use of alcohol, sedatives, and tranquilizers. Smoking is also a significant risk factor, as it can irritate and inflame the airway, further contributing to obstruction. Addressing these modifiable risk factors can significantly reduce the risk of developing OSA. Diagnosing OSA typically involves a sleep study, also known as polysomnography. This test monitors various physiological parameters during sleep, including brain activity, eye movements, heart rate, breathing patterns, and blood oxygen levels. Sleep studies can be conducted in a sleep lab or, in some cases, at home using portable monitoring devices. The data collected during the sleep study helps determine the severity of OSA. During a sleep study conducted in a sleep lab, sensors are attached to the patient's scalp, face, chest, and limbs to monitor various physiological signals. The patient sleeps in a comfortable bed in a private room, while a technician monitors the data throughout the night. The sleep study provides detailed information about the patient's sleep stages, breathing patterns, and oxygen levels. Home sleep apnea testing, or HSAT, is an alternative to in-lab sleep studies for diagnosing OSA. HSAT involves using a portable device to monitor breathing, oxygen levels, and airflow during sleep at home. While HSAT is more convenient than in-lab studies, it may not be appropriate for all individuals, particularly those with other sleep disorders or medical conditions. The suitability of HSAT is determined by a physician. The results of the sleep study are analyzed by a sleep specialist to determine the presence and severity of OSA. The severity of OSA is typically classified based on the Apnea-Hypopnea Index, or AHI, which represents the number of apneas and hypopneas, or partial airway obstructions, per hour of sleep. Based on the AHI and other factors, the sleep specialist will recommend an appropriate treatment plan. Breathing easy again. Treatment options for OSA. Continuous positive airway pressure, or CPAP, is the most common treatment. It involves wearing a mask that delivers air pressure to keep the airways open. Lifestyle changes such as weight loss, regular exercise, and avoiding alcohol can significantly improve symptoms. Maintaining a healthy diet and engaging in physical activities can help reduce the severity of OSA. Other methods include using nasal strips, adjusting sleeping positions, and utilizing humidifiers to keep airways open. Nasal strips can help improve airflow, while sleeping on your side can prevent airway collapse. Humidifiers add moisture to the air, reducing congestion. In some cases, surgery may be necessary to remove excess tissue, reposition the jaw, or even implant devices to stimulate the airway muscles. Surgical options are typically considered when other treatments have not been effective. Oral appliances, which are custom-fitted by a dentist, can also be used to keep the throat open by repositioning the lower jaw and tongue. These devices are often used for mild to moderate cases of OSA. Positional therapy involves using devices that encourage sleeping on one side rather than the back. This can be beneficial as sleeping on the back often worsens OSA symptoms. However, some may find these devices uncomfortable or difficult to get used to. Stress management techniques such as yoga, meditation, and relaxation apps can also play a role in managing OSA. Reducing stress can improve sleep quality and overall health. Consult your doctor to find the best treatment for you. It's important to work closely with healthcare professionals to determine the most effective approach for your specific condition. With the right treatment and lifestyle changes, many people with OSA can experience significant improvements in their quality of life. There is hope for better sleep and better health. Please subscribe to our channel for more informative content on health and wellness.